In order to accelerate the flattening of our curve, we are today introducing additional measures to contain the spread of the virus in the designated areas. These areas I am talking about are the two estates of Isli and Old Town, where we had imposed the restricted movements in and out of these estates. These include prohibition of hawking, street hawking, and any form of hawking within Isli and Old Town in Mombasa. Prohibition of gatherings of whatever nature, and continued closure of malls, markets, restaurants, and eateries in these two closed-off areas. Fellow Kenyans, we have observed that since we issued specific guidelines on reopening of eateries and restaurants, some of the facilities have complied to our protocols, while others have not. I am therefore warning against non-compliance and state action that shall be taken against those who fail to follow the protocols provided by the government. We have noted that a number of establishments, while complying perhaps with physical distancing requirements, may not have fully complied with the testing requirement of those employees within those facilities. All the requirements must be complied with. The facility must be inspected by a public health officer before you can go back into business. Over the last 24 hours, we have tested 1,611 samples. Of these, 28 have tested positive for Covid-19 disease. These 28 are broken down as follows. 24 of these are Kenyans and 4 are foreigners from Tanzania. This now brings the number of those who have tested positive in the country to 649. The overall number of samples that have been tested in the country so far stands at 31,041. The positive cases are distributed in the counties as follows: 10 in Mombasa, 9 in Nairobi, 4 in Migori, 2 in Kajiado, and 1 each in Machakos, Kiambu, and Homa Bay. It does concern us that we are beginning to see the numbers within some of these border counties of ours, like Migori and Kajiado, slowly rising. And it's a matter of concern, and this is where I think the issue of being able to test the truckers coming in becomes very important. All the 28 positive cases were picked by our surveillance teams. The cases are spread in the following estates in Nairobi: 3 from Embakasi, 2 in Isli, and 1 each from Kayole, Huruma, South B, and Kawangware. The 10 cases in Mombasa are 4 from Vita, 4 from Nyali, and 2 from Likoni. The others are distributed as follows: Migori, 4, Kajiado, 2, and 1 each in Homa Bay, Kiambu, and Machakos. In terms of age, the cases range between 11 years for the youngest and 81 years of age for the oldest. By gender, 17 are males, while 11 are females. I'm happy to note we have registered 5 additional recoveries. This brings the number of recoveries to 207. Unfortunately, we lost one more patient to this disease in Mombasa, bringing the number of those that have succumbed to the disease to 30. I want to take this opportunity to express our heartfelt condolences for the family of the deceased, to the family of the deceased. The positive cases show that the virus is beginning to establish itself firmly within our communities. And in order to stop the cycle of transmission, I'm appealing to Kenyans to present themselves for testing and to observe the containment measures as advised by the ministry. To repeat again, these measures include regular hand washing, social distancing, proper wearing of masks, avoiding gatherings, and staying at home unless it is necessary or essential for you to be out of your home. Staying at home is one of the safest things you can do. Further, we note with a lot of concern the continuous identification of new cases in the border counties, particularly Migori and Kajiado. I've already alluded to that. We call upon the management of these counties to ensure that surveillance and screening procedures are adhered to in line with laid down protocols. In addition, the Ministry of Health will work very closely with these border counties and partners to support them in responding to this COVID pandemic, particularly in terms of being able to build capacity to be able to test for the virus at these points. Additionally, the ministry is working with partners and has sent a health support team to Mandera to conduct targeted testing of identified hotspots. So far, a total of 241 samples have been collected from these hotspots in Mandera and have been flown back to Nairobi for analysis. Further, in responding to the increasing demand for testing by truck drivers, the Ministry of Health, in collaboration with County Government of Kajiado, is working on setting up a testing facility at the Namanga border point. On a different matter, let me take this opportunity to inform you that tomorrow, the 10th of May of 2020, is Lupus Awareness Day. This day is celebrated globally to raise awareness about lupus and to honor all those battling this disease. Lupus is a chronic autoimmune disease whereby the body's immune system becomes hyperactive and attacks normal healthy tissues. I want to wish all lupus warriors well as they combat this disease, and to inform them that the Ministry of Health is working on a program to promote community awareness of the disease, even as researchers continue to look for a cure.
Really to thank members of the press for the support and cooperation that we've been able to receive from you. Today really is about 5 or so days to 2 months. And in that period of time, we've been able to work together every step of the way. And indeed, a campaign like this requires that nature of cooperation. And therefore, from me, really just ask you that as we continue to battle this disease, the best we can do really is to expand and deepen that level of cooperation, because it is the only surest way that we can be able to effectively combat it and also be able to flatten our curve, because through you, we are able to empower the members of society in as far as information about COVID.